Okay, so let's start with the next part of our lecture. So let's go on to the tumor markers na mismo. Okay? So what are tumor markers? So tumor markers are substances found in increased number in the blood and other body fluids that may suggest the presence of cancer. So, 'di ba, very accessible siya. Kuha ka lang ng blood, kuha ka lang ng body fluids, for example, saliva, for example, gastric na fluid. So very accessible siya kasi hindi na natin kailangan 'di ba, biopsy, kailangan natin tatanggal ng tissue from our body. And actually, we don't want that. We want na kung pwede, blood lang kasi dadami lang naman yung blood or body fluids lang, 'di ba? So that is why tumor markers are very indispensable in the detection of cancer. So it will suggest the presence of cancer. Ito, I have a question here. Are tumor markers 100% in detecting the presence of cancer? So yes or no? So actually they are not 100%. So they are not 100% specific, they are not 100% sensitive kasi tumor markers are secreted by our body and hindi natin alam na if cancer ba talaga ang cause ng increase of our tumor markers. So the tumor markers, uh, these are markers na kailangan natin i-correlate with other diagnosis or diagnostic procedures in our patients. So for example, a patient has kunyari prostate cancer. So yung increase ng kanyang prostate, so when you look at here, 'di ba, PSA, prostate specific antigen. So pag increase ang kanyang prostate specific antigen, you cannot say agad na cancer siya, na prostate cancer siya, prostatic carcinoma. Pero you can do other tests. So for example, biopsy, you can do biopsy or you can look at the clinical of the patient kung grabe na ba siya, wasted na ba siya, payat na ba siya masyado, lethargic ba siya, nagka-cough ba siya ng blood, ganyan nga. So you have to look at the other parts of the diagnostic procedures of the patient so that you can say na yung tumor marker talaga na yun is caused by cancer. Okay? Pero it is very helpful pa rin kasi it can be an adjunct or it can help our physicians in detecting cancer. Okay? So, mostly they are proteins and they are produced by the cancer cells themselves or the body in response to the cancer. So ito, 'di ba, the prostate, ito yung prostate, ito siya prostate. So when there is the normal prostate will only secrete small amounts of PSA. So small amounts lang of PSA into the blood. Pero when there is prostatic cancer, prostatic carcinoma, there will be an increase in the PSA produced by the prostate. So, pag kita mo, 'di ba, test mo ang PSA, tapos low lang ang PSA, sasabihin mo, hindi man, wala man, normal lang, low lang ang PSA. Pero pag test mo, pagka next 2 weeks, pag test mo, hala, increase na ang PSA niya. So you will suspect na the patient has prostate cancer. Kasi 'di ba, the cancer cells themselves will produce the PSA. Pero there are also times na our body, so yung other parts ng ating body, kunyari when uh, when you have yung mga lung cancer, ganyan, lung cancer, pwede na yung other parts ng ating lung aside from the cancer cells themselves will produce the tumor marker. So not always ang cancer cells ang nag-produce ng tumor marker. So pwede yung body natin in response to the cancer. Okay? So what is the ideal tumor marker? So the ideal tumor marker should be tumor specific. So when you say tumor specific, dapat increase PSA, prostate cancer agad. Ganyan, 'di ba? Tumor specific siya. And then absent in healthy individuals. Dapat pag normal ka, wala ka talagang PSA sa iyong blood. And then readily detectable in body fluids. So you can check it sa blood, urine, saliva, gastric lavage, ganyan. But, so naglagay ako dito, but not ideal tumor markers are actually not present in our body. So PSA is actually not PSA ating gamitin ha. Is actually not tumor specific. Kasi when there is increased PSA, hindi mo masabi agad na there is prostate cancer. 'Di ba? Sabi mo agad increase PSA, prostate cancer agad. It may be uh, driven by other na mga mechanisms. For example, maglaki lang ang prostate, hyperplasia lang ng prostate, yung sinasabi nila na BPH or benign prostatic hyperplasia. So yun na siya, naglaki lang pala yung ating prostate, pero increase ang PSA. Pero it is not specific for prostate cancer, di ba? And then not all tumor markers are absent in healthy individuals. Kasi di ba sinabi ko kanina, the normal prostate will produce small amounts of PSA. So actually, they are present in healthy individuals. But most of them are readily detectable in body fluids. So there is actually no ideal tumor marker. Okay? So, since there is no ideal tumor marker, so magkaroon na lang tayo ng criteria or parang characteristics ng tumor markers. So first, measurable, alam niyo na yan. Then highly sensitive. So maliit lang na cancer, maglaki na agad or magdami na agad yung tumor markers. Then highly specific. So when you say PSA, specific siya for the prostate, dapat ganyan. And then cost effective kasi anong kwenta niya kung mahal siya masyado, 'di ba? So dapat cost effective siya. And then the test results contribute to patient care and outcome. So for example, increase ito na tumor marker tapos wala naman siyang kwenta. So bakit ka pa mag-measure ng tumor marker, 'di ba? So dapat all of these characteristics or all of these criteria are satisfied by our tumor markers. So ito, what are the uses of our tumor markers? So ito, tingnan nyo dito, screening, diagnosis, prognosis, monitoring treatment, and detection of recurrence. So screening, so yung mga, when you say screening, di ba yung mga asymptomatic na individuals, yung mga walang manifestation ng cancer, gusto mo screen sila if they have cancer. So what can be used for screening actually is PSA or the prostate specific antigen. Kasi, di ba, when there is increased PSA, so pwede mo siyang sabihin na baka there is prostate cancer kahit wala namang manifestations, di ba? So when there is increased PSA, pwede ka mag-biopsy. So tingnan mo yung prostate, and then tingnan mo yung cells if the cells are abnormal or cancer na yung cells sa ating prostate. So yan yung screening of asymptomatic or yung mga walang manifestations ng cancer. So actually PSA lang talaga ang established as a screening tumor marker. And then it can also be used for diagnosis. So for example, mataas ang metanephrines, mataas ang prolactin, it can indicate what type of cancer or what type of disease the patient has. Okay? So later we will be discussing the tumor markers one by one. And then ito prognosis. So when we say prognosis, ito yung long-term outcome ng ating patient. So what if grabe ang increase ng ating tumor markers? 'Di ba pag grabe ang increase ng tumor markers, it means very advanced na ang disease, very aggressive na ang disease. So when there is high levels of tumor markers, it is actually of poor prognosis to the patient kasi very aggressive na nga ang ating cancer. And then again, monitoring treatment. So, 'di ba, alam mo na may cancer ang patient, and then kunyari PSA pa rin, we measure the PSA tapos very high ang kanyang PSA, and then nag-treat ka na, gitreat mo na yung patient, nag-surgery ka na, chemotherapy, and then radiotherapy. So nakita mo na after ng treatment ng patient, the PSA became lower or decreased. So yun siya, very important din siya in monitoring treatment. And also for the detection of recurrence kung babalik ba ang cancer. So ito, again, the only tumor marker that can screen asymptomatic populations is prostate-specific antigen. So, di ba, actually, this is a very common tumor marker that is measured in the lab. Kasi, most clinically used tumor markers, so yung other na mga tumor markers, are found in normal cells, leading to false positive results. So, what if measure ka ng isang tumor marker na meron pala siya sa normal cells. So, kunyari, what if HCG, nag-measure ka ng HCG, tapos, di ba, HCG is measured in pregnant patients, di ba? So, there is actually a normal level of HCG in our body. Tapos, sabi mo na, ano agad yan, testicular cancer kaagad yan kasi positive HCG, pero hindi mo lang pala alam na ovarian cancer na yan kasi increased HCG, pero hindi mo lang pala alam na ano pala siya, pregnant lang pala siya, 'di ba? So PSA lang talaga ang tumor marker that can screen asymptomatic populations. So, what if false positive ka? Kunyari, sabi mo, hala, kataas ng kanyang lactate dehydrogenase, mataas. Tapos sabi mo, may siyang leukemia kasi mataas ang niya, tapos chemotherapy mo na siya, surgery mo na siya, radiotherapy mo na siya. Tapos yun pala, infection lang pala yun. 'Di ba? So, very bad siya para sa ating patient, 'di ba? So next, susceptibility testing. So ito, susceptibility of an individual, 'di ba? Sinabi ko kanina kay Angelina Jolie, 'di ba? Can be determined using molecular testing or the testing of the genes in breast, ovarian, and colon cancers. So yun actually ang ginawa ni this is very common sa US. So yun yung ginawa ni Angelina Jolie kasi yung kanyang family, marami sa kanila ang may breast cancer. So actually they have the BRCA1, BRCA2 or BRCA1, BRCA2 mutations that can lead to breast and ovarian cancers. So when you test na, 'di ba, pag test mo sa genes tapos may mutation ang BRCA gene 1 or BRCA2 or BRCA, so sabihin mo na very susceptible siya. So baka in the future she will have breast cancer. So yun, nagprophylactic mastectomy siya. So tinanggal niya na agad yung breast niya para hindi na mag-grow yung kanyang breast cancer, even though wala pa naman siyang breast cancer, 'di ba? So this is actually very good for testing the susceptibility of patients to cancer. And then the APC or the adenomatous polyposis coli gene mutations, 99%, greater than 99% of those with the mutations in APC gene will have colon cancer by the age 40. Okay? Next, prognosis. So sinabi ko na ito kanina, when there is increase in the tumor markers, there is actually more aggressive cancer, more advanced cancer. So, pag mataas ang ating tumor markers, you can say na very difficult to treat na yung patient. Okay, so you have to give aggressive chemotherapy, aggressive medication sa ating patient para ma-stop natin yung cancer. Okay? And then ito, sinabi ko na again kanina, monitoring effectiveness of therapy and disease recurrence. So for example, PSA, mataas yung PSA natin, and then the patient is diagnosed with prostatic cancer, 'di ba? And then you will give first line therapy. For example, nag-surgery ka sa patient and then nagbaba na ang kanyang PSA kasi there is the success of the treatment. So magpunta na siya sa cut-off level na kung hindi na siya non-cancer level na. So again, after surgical resection, chemotherapy, radiation, which are the treatments for cancer, tumor markers are routinely followed serially. So mag-test ka after mo ng surgical resection doon sa prostate, and then chemotherapy, mag-test ka PSA every 2 weeks, every 1 week, ganyan, depende sa patient. So that you can follow kung magbaba ba siya ang PSA and successful ang ating therapy. So effective therapy will be manifested with a decrease or disappearance of a tumor marker. And then after effective therapy, so 'di ba effective ng therapy, normal level na yung PSA natin. Then after 1 month, nakita mo tumaas na naman ang PSA. So there is actually recurrence of the cancer. So 'di ba very important din yung PSA, yung tumor markers, kasi nasa normal levels na siya tapos tumaas na siya after. So yun na siya, kailangan mo nang treat again yung cancer kasi nag-recur na yung cancer. Okay, there is the increase again of the tumor marker. So let's go to the types of tumor markers. So I'll stop the video muna dito ha.